My name is Dr. Louise Mapleh Kpoto. I'm an obstetrician gynecologist and work at the Mapleh Clinic in Monrovia, Liberia, and I'm a Liberian. I became a beneficiary of the Merck Foundation program through the Ministry of Health. There was an ad for it, and then I was the president of the Liberian Medical and Dental Association, and been having interest in in vitro fertilization. It has always been my dream to be a fertility specialist. And I just seized the opportunity when the minister told me that Merck wanted to help Liberia, to help infertile women. And I just saw, well, this is my time to be able to help my country people and accomplish my dream. The training was exceptional in India, exceptional. There is nothing comparable to it. I learned a lot. It was a lot of hands-on. It's not just only teaching, but hands-on. Where I went in Udiport, there's a simulator that they have that help a lot. Okay, I used to stay there sometimes till 2 a.m. in the morning on the simulator. And then in the morning, we had hands-on. We had lectures. So it has made me to be an expert in 3 months. The skills I obtained in India through the Merck Foundation program, I've already started to utilize the skills. It's very, very useful. If you look outside the consultation room, you see some females who are here for me to do ultrasound. I have the skills I obtained from the TVS is exceptional, so I do it like 10 patients per day. I also do a lot of counseling for in vitro fertilization. I have just started doing IUR. I have done 2 patients with IUR in the last 2 weeks. So today or tomorrow we are doing our beta HCG test to know whether they are positive or not from the pregnancy test, whether what I've done was fertile. So it has been exceptional. Counseling, treatment, are using Clomate. They're using the control ovarian stimulation, but I'm using Clomate. And what I don't have now is the IVF, but I'm starting from the IUR counseling, and then I'm sure I'm going to step up to the IVF in the near future. Since the training I obtained in India, I'm now looking at IVF in a different perspective. I'm also doing things completely differently. Initially, before going to India, I did not know about controlled ovarian stimulation. Now I'm stimulating patients. I did not know how to even track the follicles. Now I'm using the vaginal ultrasound in tracking the follicles. I did not know how to do IVF. Now, with the help of the young embryologists I will also train, we are now doing IUR. Although I have not reached to the stage of IVF because I do not have the materials to work with, but we are now doing IUR. I have done 2 patients. Besides the 2 patients with the IUR, there are numerous patients, over 75 patients that I have seen using Clomate. Some became pregnant. I don't have the figure of those that are pregnant, but some became pregnant, even counsel. So from the counseling, people have even gotten pregnant. Some of the patients have gotten pregnant just from counseling because they did not know when to have sex, safe sex, and when to have sex during a fertile period. So a lot, I don't know how to overemphasize the training and the impact it has made in my life as well as in the life of my patient, and it's going to be cascaded down to the country as a whole, because this is Monrovia and Monrovia is not Liberia. So I have intention of going into the counties with the skills that I've obtained from Merck Foundation. To Merck Foundation, on behalf of the women of Liberia and Liberia, I'd like to express our sincere thanks and appreciation, because the training that I received, it has been cascaded down to them. They're results oriented. We have women who've gotten pregnant, not through IUR, but through counseling and through Clomate. And just thank you. Thank you for helping the infertile women in the world. Thank you so much.